Hey, so this podcast is all about nailing it and really treating nail disease if you have it. If you do have it, the possible causes, and we're going to look at if medical conditions can cause it, medications can cause it, dietary deficiencies can. We're going to touch on skin cancer of the nail too. You can actually get cancers of the nail, and actually how to really take care of them yourself at home, and when and what to do if you do have any of these problems. I'm also actually going to cover the top 5 most common nail conditions out there, what they are, and actually what you can do to help, and the most common treatments available for them. So yeah, let's get going. So one of the real things that a lot of people don't realize is actually why we have toenails. So toenails are like armor. They help to protect the tips of our toes because underneath are the ends of our bones. So there's not a lot of fat there, not a lot of tissue. So actually our toenails are there for armor and are there for protection. I think going back genetically, they were obviously there to help us fight, hunt, gather food, etc. There's a theory for that, but look, let's just go with modern day. It's there to protect the ends of our toes. Trauma is really one of the biggies with toenails. So you can have blunt force trauma where you drop something on your foot, you can stump your toe. It can be trauma at work. It could be just repetitive micro trauma that you're just wearing consistently the wrong size shoe. So what actually that can cause is the loss of toenails, infection. And that actually can become quite painful and quite disabling, and actually can affect the nail regrowing and the condition that the nail regrows. So as a damaged nail is more susceptible to fungal infection. It can at times grow back thicker, more distorted, or actually it cannot fully reattach distally. Or you can have the ends of the toes grow up so big and high that it's really hard for the nail to grow to its fuller length. So it can actually get quite complex to actually treat such a common nail condition. Can actually also be quite disabling nail conditions too, such as trauma, because you're unable to do the things that you love because of your toes so restricting, such as running, doing your ideal activities, your sports activities, wear the shoes that you actually want to, and you can actually change the way that you walk, which can also subsequently cause additional foot pain. So it's very, very common. It can actually get quite complex quite quickly, and everyone will respond in a different way, and it's actually taking you as an individual and getting the right treatment at the right time. The second most real common thing that we see in the clinic are fungal nails, and fungal toenails are actually really difficult to treat. One, because they grow so slowly, and to actually start to see a result in any treatment takes actually quite a long time. So patients needed for us podiatrists, but also you, so treating at home. Treatment depends on how much of the nail is actually diseased, and how many toenails that are actually diseased is to really what treatment I would recommend. But basically you've got over-the-counter treatments, you've got oral terbinafine or Spornex medication that's available. You have low-level laser or laser treatments, which are cold or hot lasers. Also, what's available is actually surgical intervention and removing the toenails. And for some people, fungal toenails is a cosmetic problem. It's not going to hurt you or harm you in any way. And for some people, they're happy with that and they don't want no treatment. But for me, that's absolutely fine. But what I would say is over time, it may spread to additional toes. And we actually have a lot of people in our clinic who actually come and have their hands and feet treated, believe it or not, because the infection just sort of takes hold really. Fungal nail infection, for me, a big key takeaway is if you do suffer with it, it is all about changing the environment your feet live in, which I suppose in a way is a podcast for another day. But briefly, things like bamboo or hemp socks, breathable shoes, treat your shoes. And a lot of people who have fungal nail infection actually have chronic fungal skin infection and don't realize it's there. They're moisturizing, which is actually feeding the fungus and exacerbating the infection even more. So I think if you really are battling with fungal skin and nail infection, pop along and see a podiatrist and really look at changing the environment your feet are living, just to successfully treat the fungal skin and nail infection and actually get results much better, much quicker too. Next is ingrown toenails. So ingrown toenails are a very common problem. They can be caused by picking, peeling, biting your toenails, incorrectly cutting them, or actually your toenail's just too wide for your toe, really. And is causing some where the toenail grows into the side of your toe as a result of that. So basically it's with the ingrown toenails, it's cutting them correctly, not picking, biting or peeling them, ensuring you're in correct size shoe. In some instances, surgical intervention is needed where you can have the whole toenail removed or just the sides which are causing the problem, so you'll still be left with a normal healthy toenail. This is common practice in all podiatry practices, and it's a successful procedure. So if you are suffering with ongoing ingrown toenails, it's definitely something that I would highly recommend do. Next on the list for me is systemic disease. So there's lots of different things which can cause the effects of the nails on your hands and your feet. One is autoimmune disease. Second is things like thyroid disorders, and if you've got any severe heart vascular issues. So sometimes these can present the nails looking thin, weak, brittle, and or don't grow. So yes, systemic disease can also cause these issues. Can also get nail psoriasis on the nails, which then leave them quite pitted, can leave them quite thick. So regular treatment from a podiatrist just to help maintain them, especially if the thickness is there. From my experience, that thickness can actually be quite sore, very tender to treat. And actually, you also get the psoriasis plaques on, in and around the nails, which will also need some debridement. So actually getting that professional advice. If you do have any of these psoriasis of the nails things, a lot of the time you're on medication from the dermatologist. Lasers, also light laser therapy is also a very valid option. Here we also use a cold laser to help with toenails in our clinic too, and any appropriate topical treatments. Psoriatic nails are also susceptible to fungal infection, so to prevent that as well would potentially be ideal for you. Aging feet, aging toenails. So toenails over time at times may become thickened, which can become painful. They may also become involuted, where they actually get quite pincer and a bit more of a pinch around the sides, a lot more difficult to cut and maintain, and they actually become very brittle too. So just natural aging feet. It doesn't happen in everyone, but that's also something to be aware of. I think it's just the general wear and tear of the nails as the decades go by, really. Environmental factors can also affect your nails. So this can be down to the chemicals that you use. It could be down to manual labour. It could be down to the moisture levels inside your shoes. So environmental factors is a really big thing that also can affect your feet. Medication can affect too. So chemotherapy drugs can make the nails fall off, very thin, very brittle, can potentially make them more susceptible to infection. If you get the lymphedema, sometimes it can coincide with your chemotherapy. That can also cause some ingrown toenails for you. So that's really definitely something to prevent. So if you are or know anyone undergoing treatment, get them to have a look at their feet. Doesn't happen to everyone, but those who do, it's actually really sore, very, very sensitive feet. And you can actually use the skin on, in and around the nail too. So it's really important that if that does happen, you're getting the right treatment at the right time. And, you know, my ethos, you're probably get sick of me saying it, prevention's better than cure. Treatment sooner rather than later would be ideal, really. The next thing, retinoids can also affect your nails. Drugs that suppress your immune system, especially if you had a sort of an organ transplant. Hormonal medication can, and also psoriasis medication can also commonly affect your toenails. So these are things that, just look at the contraindications on the packet. Obviously, if you are getting some nail side effects with your medication, I think the benefit of taking the medication outweighs what happens to your toenails. You know, podiatrists can manage that for you as best as they can, depending on what's causing it, and take it from there. Toenails can actually cause a disability. What they can do is, if they're painful, if they cause discomfort, it can affect what activities you do, what footwear you do. It can also affect how you think and feel about your feet, and if there's any shame there, any embarrassment there, which is also very common as to what activity you'll do and what footwear you choose to use. So I think sometimes a little problem that can actually be very life-changing problem. So I'd always advise, depending on what's wrong, what can be done to help, and then seek treatment again sooner rather than later. Common question I'm asked time and time again in clinic: does dietary deficiencies affect your nail growth? And it tends to be menopausal women asking me this at times, not always. And the crux of the answer, yes, it is. So a lack of protein, zinc, vitamin C, vitamin D, biotin, and B12. Eat in isolation they can. Sometimes if you're deficient in one, you can be deficient in others. But basically, an iron deficiency too. Basically, what they can do is the nail grows thinner, much weaker, much slower, tend to split, tend to peel quite regularly. These are all classic signs of deficiencies of what you can get in how the nail should look and the quality of the nail and the healthiness of the nail. So if you are suspecting any of these, a lot of the time it's blood tests to confirm that you have it. And then that will ensure that you get the right dose of which vitamin that you're actually lacking. I think if you look at anything, which vitamins to take, there's good press and there's just as much bad press to say that they don't actually work. But I think the biggest thing is just having a really good varied diet and also what you're lacking. I feel that's a podcast for another day on supplementation, but I also feel it's worth mentioning the condition of the nails can also be caused by what you're actually lacking too. A big hot potato now the summertime's here is cancer of the foot. I think it's in and out of the media all the time, but it's definitely something that's in the forefront of our CPD as a podiatry profession very, very regularly actually. So I was actually astounded by the stats that they showed us at the conference, Royal College of Podiatry conference last year, of how things are changing and the awareness of skin and how actually lesions present differently depending on the colour and texture of your skin and age too. I just want to go over how cancer can present in the toenail. So a lot of the time it's just one toenail. And there's no history of injury or trauma. Sometimes there can be discoloration. A lot of the time it's not symmetrical, the lesion, and you can have more than one colour too. A lot of the time the edges may be irregular. You can have some nail separation where the nail is not attached to the nail bed. Sometimes you can have an ulcer, can be weeping, can be bleeding. And a lot of the time it can have rapid growth. So you've noticed, oh, wow, that's growing. If you have any of those or any concerns, I would just urgently book in to see a dermatologist or podiatrist. They'll be able to do a further assessment for you, but ultimately, highly likely a biopsy will be needed just to confirm the diagnosis. But obviously, one, to get that nail disease confirmed what it is, to get you on the right treatment care pathway. I think we're all familiar with the famous Bob Marley lost his life due to cancer of the foot. I'm not saying it to scare you. I think it's just more awareness of the body. So if you do have any lumps, bumps of the feet or any moles, take a picture of them just so you've just got a benchmark just to track the progress of it, just to ensure that it's just stayed the same. Sun cream on the feet. Everyone forgets their feet, right? You always see people walking around with burnt feet and toes. Don't forget to do your feet, and more so don't forget to do the soles of your feet, especially if you're sunbathing. It's really, really important. I couldn't think of anything worse than burnt soles of feet and trying to walk after that and the day afterwards. Ouch. So yeah, I just really want to bring that to everyone to highlight. Cancer of the nails is there. It does exist, and get help if you're in doubt for sure. And then I just really want to finalise nail care, what to do with your nails. So I'm always asking the clinic, do you cut straight across or do you cut down the sides? And I always say, I don't like the advice of cutting straight across. It is a personal preference. There is nothing wrong with that, but I always say cut the nail to the nail shape. So depending on the shape of your nail, that's really how I would cut the nails. If they cause you no pains, no issues at all, a lot more and more now, it tends to be a personal preference, or actually what cosmetic appearance do you actually want to show with the nails. So that's really my take on that. If you have any dryness, the Callan olive nail oil is absolutely fantastic at treating that. Onycholysis, where you get the nail separation, it's fantastic at reattaching the nail bed. Or if it's deficient in any way, it will nourish, hydrate, replenish, moisturize the nails. You get instant results. Keep it in your handbag and use it continuously too. The other thing, if you do feel that there are lots of skin and nail supplements out there, if you do feel that you just want to give yourself that extra boost, please do. The other issue is naked toenails or not. So that, again, naked toenails, I mean varnish or not. That's a personal choice, up to you. What I would say, if you are using polish, especially gels, give the nails a break, feed them in between with a really good nail and cuticle oil, allow them time to breathe, really give them some TLC. Signs of nail damage, you can get some thick white patches on the nails. That also may be a sign of fungal infection. So I always think, if in doubt, please get it checked. So this podcast is intended for information purposes only. I feel it's been a bit of a whistle-stop tour just to actually demonstrate to you how hard and difficult it can be to treat toenails at times, and to actually just give you some more information of the potential risks and things that you probably don't associate that may actually affect your toenails too. So probably what I would say is I'm all about tailoring everything to the patient's needs, wants, desires, and outcome and results. So when you look at nails, it's all about how you want them to look, how you want them to feel, and that varies from person to person. But really, the advice I really want you to go away is, please don't use this as treatment. I really want you to go get the right assessment, ensure you got the right diagnosis, and you're on the right treatment plan for you and the results that you want. So yeah, that's really what I want to take away from this, is see a dermatologist, see a podiatrist. We treat skin and nails all day, every day. You know, we are experts at what we do. So just go and get that expert help to get you the result that you want, really. Cheers, bye.